Yeah. So we are going to see um, new component which traditionally a physiotherapist doesn't commonly look into. It's called as a behavior change. And some of you might be familiar with the term behavior change, but for many others, it might be something which you are hearing for the first time in a physical therapy practice. So what we are going to do is we are going to um, have approximately 6 sessions, and each month 2 sessions. Now we are going to have the next 3 months. So we are going to first basically look into what's a behavior and what's the difference between a behavior and a behavior change. Number two, in the second month, we are going to look into what are determinants of behavior. That is what decides a person to do something in a particular way. And in the month three, we'll be looking into a lot of research which is currently ongoing in this field of behavior change. For a very long time, physiotherapists have been traditionally limited to treating disorders of movement. But as of date, we have come to understanding that a person, if he has to have a good health, it is not enough that we are making him move directly by instructing him to do exercise, but it's influenced by a lot of factors. Okay, so that's what we are going to try and understand in the following 6 presentations. Okay. The first question is why we need to look at behavior change. Okay. Now, traditionally, we have been looking into many diseases, and each of the diseases have been treated by the doctors. And this basic treatment has come out of a particular understanding about the nature of the cause of the disease. We all know that we have been affected by diseases like COVID. Uh, from a very long time, we have been suffering from many other diseases like jaundice, malaria, and a lot of other diseases. And in each of these diseases, we know that there is a microorganism which enters the body, and it creates all the problem. So, if at all we have to treat the disease, we need to attack directly the microorganism, right? So that was what was the understanding about the disease amongst the medical professionals. Similarly, we know that whenever there is a pain in a particular region, say for example, knee joint or hip joint or any other region, we know there is a tissue damage which has happened, and because of it, inflammatory chemicals are there, and we apply a heat therapy in order to remove those chemical substances which are causing it, right? And thereby we try to treat the cause and take out the reason for that. So this is how we have been looking into diseases from a very, very long time. This is called as a medical model of a disease, and was taken up by World Health Organization, and said that any disease will have a particular cause, and you need to always try to address that particular cause. So if you see at the disease profile, what I mean by disease profile is all the diseases which affects a man particular picture. You can see on one side a column which is blue, and the other side you can see a red column and a green column. The blue ones are called as non-communicable diseases like cardiovascular disease, stroke, back pain, obesity, right? Chronic obstructive pulmonary disease. These are non-communicable diseases. You see on the red, which is infectious diseases like your tuberculosis, malaria, filariasis, a lot of other diseases. And on the green, you can see the diseases which are caused by environment like pollution or accidents. Okay. So all the diseases which had killed mankind, as well as which has actually caused a lot of disability, right? When it was all put together, right? You can see that infectious disorders is a major chunk, followed by non-communicable diseases, and a small portion played by diseases which are caused by environment. Now, this was the disease profile in 1990. However, when you move on to 2019, 30 years down the line, you see that the scenario has changed completely, and non-communicable diseases has now taken the major portion. So majority of the diseases which affect the mankind that kills as well as causes a lot of disability is non-communicable diseases. Can you tell? Okay. Is my voice audible?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So you see here that there is a complete change in disease profile, that is of the mankind completely, right? And infectious diseases have not reduced, but we have found effective treatment and cure for infectious diseases in the past, right? Although the presence of COVID now questions that, and it might be putting us back a few years in our growth history for health, right? Still, we understand that in the current point of time, non-communicable diseases are major killers. Now, when you look into these non-communicable diseases, why does these diseases come? Ischemic heart disease or stroke or psychological diseases like depression, diabetes, hypertension, COPD, back pain, everything, right? Now, a major reason for this is the lifestyle of the person. What do you mean by lifestyle of a person? Healthy lifestyle will not be suffering from majority of these diseases, but a person who has a very unhealthy lifestyle will be affected by these diseases. Right? And already since over the past 30 years, there is a shift in profile. We understand that the mankind as a whole have been moving on from very unhealthy, a more unhealthy kind of lifestyle, which has resulted in the increase in these kind of diseases. So it becomes very important that we understand. One second. Is my voice again audible or it's not audible? Okay, right. Yeah, a majority of these, as I have told, is caused by lifestyle. Okay. So these lifestyle disorders, right, and these non-communicable diseases which are caused because of lifestyle are caused not by single agents, unlike the infectious diseases, but we know are caused by multiple factors, which involve the host, that is us, our own behaviors. It is also caused by the environment in which we live in. And we tell an environment, it's not only the physical environment, it's also the people who surround us with, that is the socio-cultural environment. The economic environment plays a role, right? And also there are different kinds of internal body morphology, like genetic factors and metabolic variables, which play a part in creating the diseases. Okay, right? So from our minimalistic understanding about what causes a disease, as a single agent causes a single disease, we have now moved on to understanding that there are multiple factors that can cause a particular, together come and cause a disease. As we all know, when you look into stroke or cardiovascular disease, you know that it is not caused in one day, but by one organism, but it is caused because of several risk factors like smoking, alcoholism, and everything. Okay. Now, hence, it becomes very important for all of us to understand that we are fighting against multiple agents. And so the tools with which we are fighting cannot be that simple. So in previous years, we very well understood that chemicals, if a pain is there in a particular region, there was a chemical substance which is released in the body. And the if you keep a shortwave or something, the heat energy is going to bring in a lot of blood to that area and it will wipe away and go ahead. But at the current point of time, even we have changed in our perspective in addressing the pain, because we understand that pain is not just caused because of some chemical substances, noxious substances which are there, but it can also vary depending on the attitude of a person towards that particular pain. If a person is very complaining, if he's have falling into a sick role, then the pain will remain in him for a very long time. But rather a person is taking his life positively, then that pain may not be affecting him so much. So not only in general causation of disease, but also in many diseases which we treat, we have come to understanding that it's influenced by multiple factors, causes. Okay. So let's take one simple example in order to try and go and understand about behavior and behavior change. Obesity. So we all know what's obesity, and we know that it's one of a major reason for many other diseases like diabetes and hypertension, which in fact can be a cause for cardiovascular disease or a stroke, right? So we are going now from the disease to the cause of it, right? So obesity, let's consider here obesity as a disease. Okay. So now the question becomes, what causes obesity? All right. So I want you to come out with some factors which you think causes obesity.
Lack of physical
Lack of?
lack of physical activities.
Okay, lack of physical activity is one cause. Yeah.
Sir, sedentary lifestyle.
Okay, that's the, I think that's slightly similar. Sedentary lifestyle, of course, there are differences. Okay, right? Sedentary lifestyle, lack of physical activity. Then
Diet intake.
diet intake, right? I think, okay, yeah. Dietary intake, that could be a problem. Then
Genetics.
there could be a genetic cause also. There is something called as a set point. Okay, right? So some people are have a preponderance, that is, they will easily get obesity, and it's very difficult for them to reverse it. Yeah. What else?
Sir, the gender, male and female.
I'm not getting. Your voice is not audible. It's not very clear.
Sir, the gender, male and female, any difference?
Okay, there might be some systemic differences between males and females in terms of the cause for getting obesity. For example, during postmenopausal period, some the women are more prone to get because of some hormonal changes. Yeah.
Side
Because of
effects.
any particular medication they take.
Yeah, side effects of medications which they take. Yeah. So basically, if you look into all these things, we can very easily divide them into 2 or 3 areas. One is the one where our body metabolism is affected because of some intrinsic factors, right? And the factors like physical activity and lack of proper diet can cause it, right? So that's more of a lifestyle related factor which causes obesity, right? Now, now let's go one layer down, and can you just think about what could be the cause for why a person is taking a improper diet? Let's not call it as an improper diet, but a particular diet which leads to obesity, obesogenic diet. Can you tell me what could be the reason for a person adopting a obesogenic diet?
The interest towards a particular kind of food.
Yeah, the interest towards a particular kind of food, right? So, okay, so you eat chips, okay, right? You eat more of a chicken or a mutton, okay, that kind of it. Right? So, what do you think causes that? Why does he develop a certain preferences towards a certain food?
So because of the availability or the taste of the food, the person favors more.
Okay, the taste, they have a craving for that particular taste, fine. Okay, what else could be the reason? Habit. Habit, yeah. So they have developed that habit of it. So the question is now, why they might have developed that habit? That's the question. Yeah.
So the availability towards that food, like the person must be having only that kind of food to eat. He's not getting any other.
Okay, right. So that could be a factor, right? So you have availability of that kind of food. For example, when you walk around Bangalore, if you see in some regions, you will have these fast food snacks, that would be so much, right? So you would have walked around Begur Road, right? And you would see that. But what you obviously see they're missing is we don't have vendors who are giving salads such as they have this watermelon, pineapple, and all those things. No, they have fruit salads and they supply. You don't see them, but rather you have places which makes more bhajis, which makes more samosas, and we have bakeries all the while, and you have pubs, right? Veg pubs, egg pubs. These are the kind of items you see around, right? But the environment doesn't give you the option for the other one. So so that also could be a factor, right? Which comes in, right? So what we are trying to get is we see that the behavior what we have right here is right could be there could be many things into it, right? So for example, this is something which I got very easy picture from internet, right? So uh, this was from a study on what are the factors that cause obesity in children, right? And you can see here food advertising aimed at children. So you see the kurkures, right? So you have famous hero breaking into heroine's house, right? And he starts seeing kurkure and he craves for it, right? Or whenever they eat, they have a large portion sizes of unhealthy food. That overconsumption of sugar sweetened beverages, that's your Pepsi, Coke, and other things. And decline in overall physical activity both before and after school hours. Then decreased physical education and recess time, that is free time at school for playing. Increased availability of low cost, high calorie refined grains and added sugars. That's the easy available snacks around. Increased screen time, sitting with video games or with mobile binging, watching short videos and other things. Community environments that inhibit active living. So you have, if you look into Begur area, you have quite a number of houses very close in that locality. You don't have parks, or you don't have places where people can run and play some games. You don't have much places around there. But if you look into some other locality like HSR or other area, you have playgrounds in there, right? And increased frequency of eating away from home. So people have identified a lot of these factors as causing obesity. Okay, right. So if you look into all of these things, right? Now factors and put into different boxes. Okay, and you can each one into one. Can you just put them into different boxes? What would you put preferably in a environment box?
The food advertisement aimed at children.
Yeah, that would go into a environment. That your environment is influencing you in a particular way. Yeah, number one.
Or community environments that inhibit active living.
Yeah, community environments that inhibit active living. Yeah, that.
Decrease physical education and recess time at school.
Okay, so that again is an environmental factor. Very good. So where would you put the eating, say, motivation towards eating preferences? Which ones would you put into that box? Are you able to hear me?
Yes, sir.
Yeah. So eating preferences, where would you put that? What would you put in that box?
Sir, increased availability of low cost, high calorie refined grains and added sugar.
Yeah, that is a part of it, but a part of it is again increased availability. That's your outside what is available. So that would again go into a kind of environment box. Overconsumption of sugar sweetened beverages, that would be a personal preference choice. Increased frequency of eating away from home, all right, that again is a personal preference choices. Okay, right? Yeah. So we see that there are different things which are involved in this. So very easily this kind of understanding about the disease immediately changes the role what we play in society. We traditionally think that if a person is coming with obesity, that we need to evaluate their body mass index, and then we need to start giving them exercises. But we also need to very well understand before giving them exercises what is actually causing this obesity, right? And if we understand that these many factors are there, then we will also have to start identifying right? How to address these items. Okay, right? So, so now we move on from just giving exercise as a being an exercise professional to a professional who understands the behavior of the person. Okay, it's not that all the children will be equally having all these factors, but some children might have over preference of consumption of drinks like Coca-Cola and other things. Some people might be some person might be consistently eating out. They might not be eating homemade food. They might be eating always outside food, right? So uh, either individually or in clusters, the different factors might be influencing a person, right? And this is where we, as not as an exercise professional, but as a behavior change professional, start coming into play, right? So some of the behaviors, right, from the previous slide, a few examples are overconsumption of sugar sweetened beverages. This is a personal preference, right? A person might particularly prefer it. So it's a behavior. Eating away from home, right? That's a behavior. Increase screen time, right? That's a behavior. Yeah. So can anyone try and define for me what is a behavior that we are telling about? You can see here that there are a few things which I have picked and put it as behaviors. Right? So what do we understand by a behavior? What do we mean by a behavior?
Things which person choose for himself.
Okay, it's something which a person chooses for himself. Okay.
So a
Generally, we are trying to
person,
define a behavior. Yeah, please.
yeah, a person adapting that behavior in their day-to-day life, doing that
Okay.
activities.
So the activity which he adopts in day-to-day life. Okay, that is a behavior. Yeah. Any other?
So a person who is acting, showing some thing in action, and that becomes a behavior, some activity or
Okay, something is overtly expressed by
expressed.
him.
Yeah.
Okay,
Which
that's
the characteristics of the individual.
okay. A characteristic of an individual. That's a slightly deeper version of it. Okay, very difficult for us to put it. We will come to that, but that's very important. A characteristic of a person. Okay, yeah.
The interests of the person.
Interest of a person. Okay.
Habits.
Habits, behaviors. Otherwise, we call it as habits, right? Yeah. Okay, right. So what's a behavior? We are actually worried about health behavior as healthcare professionals. But first, what's a behavior? A behavior is an action, activity, or a process which can be observed and measured, right? And that is initiated in response to a stimuli. Of course, using this word response to a stimuli is putting it into a very minimalistic or a wrong way of it, but we'll come to it later. So when you tell a behavior, it is an action, activity, or a process which can be observed and measured, right? So when you said it's a characteristic or it's an interest of a person, it is something which is not very explicit. We may not be able to identify it directly. Okay, right? But when we tell a behavior, it should be possible for us to look into it and document it. Okay. So the preferences, the characteristics might be there, but sometimes it might express itself. Sometimes it might not be expressing itself, but it might be underlying. Then it is very difficult for us to tell that a person is having such a behavior. So we cannot tell just a person's characteristic as a behavior, right? So that's the basic difference. So when we are defining a behavior, what we have to define is it should be observable. That's number one, and we should be capable of measuring. The second part of it that is initiated in response to a stimuli is something which I just kept it for a historical sense, because traditionally when you look into behavior, or there is a field called as behavioral psychology. It's an entire field. You all are very familiar with the experiment of Pavlov, where he made a dog to salivate in response to a stimuli, that is a bell, instead of food, right? So that's called as a conditioned behavior. And when we are looking into a health behavior and trying to influence a person's health behavior, we are trying to do something like that. But from the time of Pavlov, from classical conditioning to operant conditioning, we have now moved on very distant direction, and we have come to this complex science. Okay, right? So it is it is no more feasible or possible for us to think in those terms and try and change kid's behavior or adult's behavior by ringing a bell. Okay, right? It's not going to be possible. So we are going to have to understand a lot of things. Okay, right? But traditionally, they react, right? There is still a component of the brain which makes a person to be reactive, right? When I say reactive, they'll be reflexly acting. For example, all of us know we all advise a lot of exercise to our patients. We all advise a lot of exercise to our friends, to our family members, whoever we meet, right? But rather sadly, we ourselves don't do it, right? So what happens? In the morning, we are supposed to get up and then we are supposed to go for a walk, right? We will be sleeping at that particular point of time. Number two, we are supposed not only to get up early morning and walk or run so that sweat comes for more than 30 to 40 minutes in our day-to-day life. We know that, but still we will not do that. But throughout the day, we have 6 hours, right? We do have opportunity to do that, but we will not be doing that. We'll be sitting very much. Evening, when we come to college and go, we will not be doing that, right? Okay. So if at all, even if you want, why don't you try doing that, right? And I know that many of you would have tried doing it, and you would know how hard it is for you to change. So it is a kind of, you are reflexively acting. Even with your conscious thoughts, it is very difficult for you to overcome the reflex part of it. So a behavior is also a habit. It also has a reflex component. That's why I had kept that term, that is initiated in response to a stimuli. Okay, right? Now, whenever we are talking over here, we are always going to talk about not just any behavior, but a health behavior. So what we mean by health behavior is a action, activity, or a process which a person undertakes that can affect the health state of an individual, healthy state of an individual. Okay, right? So that's what is the domain that we are trying to explore in this behavior and behavior change. Are you clear as to what is a behavior?
Yes, sir.
Yes, sir.
Yeah, right. So so when you define a behavior, you need to be very clear, because defining a behavior very loosely or ambiguously doesn't help us in changing something. It becomes very difficult for us to influence a behavior change unless and until we put 4 corners to it and tell, okay, this is what we are trying to change. So whenever you are trying to define a behavior, you should always tell who should do what, by when, and in what context. So when you're defining a behavior, you need to have these 4 basic components. That is, which individual has to do what, okay, what they have to do, by when they will have to do that, and in what context. What context means in which environment they will have to do. This is what is required in order to comprehensively define a behavior of a person. So if you're going back here, right now, when you take increased screen time, right? So, for example, let's say that Princey keeps watching movies all the time when she goes in the evening, right? After seeing a patient, and let's have it, right? So, and here, the behavior, the unhealthy behavior which we are having here is Princey, that is the person who, right, does what, right? Is watching movies, right? From when in the evening after seeing a patient, she starts watching the movie from this time to this particular time. All right, yeah. And in what context, right? So does she do it every day or does she do it occasionally? All right, that is what something. Kunsi, can you throw some light on that?
Occasionally.
Occasionally, okay, right. And then that's not a bad behavior. Okay, right. I don't know what other behavior is there, but occasionally, okay, right, okay, fine. So that's an example of I'm giving a context, but the context can be anything. It could be a physical context, it could be a context where multiple people are involved and things like that. Okay, right, clear. So Princey should not eat biryani, whenever chicken biryani, whenever she goes out with friends, right? So that could be a context. Okay, right. And she's alone, she might be eating nicely, but when she's going with friends, it might change, as happens with all of us, right? So that could be there. So that's what we mean by who, what, by when, and in what context. Do you understand what how do we define a behavior?
Yes.
Yeah.
Yes, sir.
Okay, right. So that's what's a behavior. Just 1 second. So 1 second, just okay. So the behaviors, right? Every person might not just have a bad health behavior; they might have also good health behaviors. So actually, when we are looking into behaviors, we should be looking into both of it, because when we are concentrating on trying to change the behavior of a person, it's not only important that we make them lose or reduce the amount of bad behaviors, but also we may be targeting their good behaviors and trying to encourage them and increase them. All right. So for that purpose, the behaviors can be basically categorized into bad behaviors and good behaviors. And whenever we are analyzing a person and for whom we want to change their behavior, we need to analyze both the good and the bad behaviors. Okay. Right. So I think we will stop here. In the next, that is on Thursday, we will look into the next part of it, which is trying to change the behavior. So what do we mean by behavior change, and how are we, what are the determinants of it? Maybe in the next class, we might try to see one or two of the determinants. But uh, so we will stop here. Okay. And if you have any doubts or questions, we can just go ahead. Yeah. So yeah, any viewpoints, any of your ideas, anything you would like to add?
Should we bring psychologists over here so
Sir?
that they are actually, yeah, I mean, they'll throw, I mean, very deep understanding about human behavior, although we are getting into this.
Yes, sir. Actually, what happens is the psychologists, as healthcare professionals, they have a major role to play in many diseases, right? But unfortunately, when a person doesn't exercise, okay, right? So it becomes the work of a physiotherapist, right? And when we think about making a person to exercise, it's very difficult for us to send him to a psychologist for consultation. So we need to start taking up some portion of it. So that's where we are starting to come in. So there is a role for us to also play in here. Of course, the science is more of
My point
psychology.
is also same, that you're the one going to deliver, but we know from the psychologist about how the thinking process of a person, whether that will help us.
Yeah, now actually, apart from psychologists, we also are having different other professionals who are contributing to this. For example, economists, there is a separate field called behavioral economics separately. There are a lot of new ideas which are coming in. And so what's happening here is there is a transition from psychologist to different kinds of professional ideas coming in and putting into it. So it's a very interesting area, and a lot of inputs are coming, sir.
Very interesting to know.
Yeah.
But and then how successfully we are going to implement this, because physiotherapists are so ingrained to the techniques and things like that. So now understanding a person, giving advice on that context and all, it's actually interesting thing. But hope physiotherapist picks up in
That's
India.
what this year we are taking up this new thing and
Yeah.
going ahead. Of course, let's see how much interest and how much depth we are capable of going into it and using it in our practice.
Yeah.
Sir, I had a question.
Yeah.
So I don't know if it is too early to ask this question, but like we are seeing now patients, we are learning to see patients through a behavioral context. And so how much important it would be for a patient also to look into that aspect, because we ourselves physios are ingrained in a very old fashioned way of looking into patients, and patients are also learning the same way because of our language. So in from patient side, what would be their
I'm not getting your which is that part that is worrying you?
Probably how to prepare the patient to deliver it, because just because we are ready, sometimes the patients are not ready in that line of
In taking we as
yeah.
physiotherapists, right? You are supposed to keep
Yeah.
ultrasound and these things. This is not your
Yeah.
duty, right? Okay, fine. I can take
Yeah,
advantage,
that's
but
not your job.
okay, right. Sebastian, is that what you're also telling?
yes, sir, exactly. That's the question.
Yeah. That's something which we will have to actually fight against. But I don't think the fight is going to be so tough, because already as exercise professionals, many people are giving a lot of advices, and also patients do fondly call us as doctors, and they also understand once they start getting the benefits, they also start understanding. And so I am really not very much clear on that, but it's a challenge, but I think we need to embrace the challenge. So I really don't have an answer how prepared they are, but the more important thing is, if they are not prepared to listen to us, then it's not going to be working out. Because when we tell a behavior, it's a behavior of a particular person, right? Or a behavior of a system, including his family, including his support system, which he's having, and things like that. So it's going to be a combined war which we are going to wage against the diseases. So
Sir,
it's
is there any model or any literature on introducing such things, like even in any condition, even in cerebral palsy,
okay.
when we are preparing the family members.
Hmm.
So I have faced most of the time they didn't want to learn anything. They simply say, I mean, they want us to do it.
Yeah.
So that sort of thing. So,
Yeah.
but is there any way to, I mean, in pain neuroscience, we are using metaphors and all those things. But
Yeah.
here, I don't know, in other conditions, how that can be.
Yeah. Sadly, we are in a place, we are caught up in a place where there is not, you're asking whether there is any, but there is many. That's the answer. There are too many material which is available, which talks about the behavior and behavior change at the current point of time. Unfortunately, we are caught into this. At least we have 80 different proven theories. We worry about Bobat, Brunstrom, PNF 3-4, right, clear. But when we come into behavioral science, there are minimum of 80 different theoretical ideas in itself, because behavioral psychology has been there from quite long, so it is there. But which works and which doesn't work seem to be at the current point of time. There seems to be specific literature coming. For example, when you tell specifically cerebral palsy, their family member, then there seems to be specific literature which is there on family members, how to deal with them and how to go ahead with them. There seems to be that. But
I think
problem
the delivery model, sir. Sorry to interrupt. I think the
yeah.
delivery model is the problem, I feel, because doctor says that so you can go to physiotherapist to learn exercise. Very
Yeah.
clearly, they say this way. So rather than that, if they say that, okay, you meet the other professional in general term or something, and they'll help you how to improve your condition or your child's condition in general terms. Maybe I think the many level we need to work on
Yes, true, sir. Very,
to
very,
make
very
it
much true.
successful.
That's the most important crux. So when we are telling about behavior, I think we should not think that we are going to change the behavior of a particular person, but what is influencing that person to do that particular behavior
Yes, exactly.
in fact be lying somewhere else in the system. So we don't go and address what is very obvious, but then what is the root cause of it? We just do a root cause analysis, go 1, 2, 3, and then also address that. That also is very, very important. And
Yes.
how to address that? The mechanisms are very different from that of addressing an individual for a behavior change. So yeah, that's a very, very important
So
Sir,
it will be very interesting thing, sir.
thing. Yeah. Yes, sir. Subbu, sir.
sir, I'm having one doubt, sir. As you have said that the 80 some techniques which has proven to be effective. So whether it is in the healthy individuals or in patients, sir, why? Because
No.
it is different between the healthy individuals and the patients.
Yeah.
So,
The theories I told 80, it covers all of it. Right. There are some theories which are very much towards healthy people, right? Something towards people who are addicted deeply in habits like smoking, alcoholism, and other things, and on to specific groups also. The theories are very many across the spectrum.
okay.
Jebastin, you had written a question. Is there a possibility that we are using behavior analyzing and change techniques but aren't aware of the usage of it? Yeah, the problem when we are using it but we are not aware about it is fine, but becoming aware about it, that we are using this particular technique is very, very important, because if we are not, if everything goes on fine, no problem. But when we are stuck up, right? If we don't know this is what is a particular technique we are using, and this is what has failed, then there are very, very minimal chances that we'll be re-evaluating our methods, and we will be improvising. So we will be just rather beating around the bush. So maybe we are using something, but generally we just simply talk. That's the major one, right? So we give a piece of advice to a person, and that's what is a major behavior change technique we use. But there are many other things which are not yet explored. So so not being aware and giving something is also as harmful, right? And we need to be aware about it. So it's fine if, even if you are not thinking about it, and if you are trying to give it, let's start changing.
Thank you, sir.
It is also one of the argument by some of the therapists says that you are all using fancy names, but we have been using this for so many years.
Yeah, right now that's because
but then yeah, it's very ill defined, and we are
no,
not going to.
actually it is pretty well defined. The only thing is we are not consciously looking into the different what to say, the literature, and reading it together. So you might read a particular literature and you might tell this is what I am doing. I might read the same, I might be doing the same thing, but I might have read something else. So collectively,
instead of crudely doing here and there, bring into some discipline.
Yes, and it's available. It's available,
kind
and
of standardization.
Yeah, it's available actually. So I think in the third month, in March, we will be I have attended I try to attend this behavior change conference in UK, right, from where a lot of work keeps coming, and a lot of papers across different behavioral spectrum is there. So in the third month, we'll probably be open to that conference, and I have the conference material also. So we'll be able to see that. So you will see that a lot of people are talking about in standard terminologies about the behavior change. Okay, sir. Okay. Thank you all for joining. We'll be meeting again this Thursday, which will be a continuation of the same part. That's about the behavior change we'll be discussing about. Okay. Right. So keep reading, keep exploring. It's a new area which has much to explore, which has much to be taken by a physiotherapist, and which will add a lot of value to our arsenal, by which we can fight against the disease spectrum profile which has changed. We need to fight against it, and we need to make the society healthier. So this is a potent tool, and I found it very interesting, and I hope many of you, when you also go through these materials, you will find it very beneficial. Thank you. We will join again on Thursday.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Great.
Yep.
Thank you, sir.